Good morning, everybody, or good afternoon to our friends in India. What a great pleasure it is to welcome you to this great conference, to this great first anniversary event, where I'm told we've got something over 2,000 people going to participate at some point during the day, 60 speakers from 18 countries. My name's Nigel Crisp, and it's my great honour to be co-chair of Nursing Now and to be hosting today with my good friend and good colleague, my co-chair, Sheila Clow, who will be taking over from me fairly shortly. I've got to say something just about the arrangements. Well, you all got here, so congratulations on doing that. And you'll see from the programme that each session is about 50 minutes long. At the end of it, you go to the virtual hub at the end, and then you go on to the next session after that. You click on the next session after that. And the next session after this will start at 9 o'clock. And don't worry if you miss some of the different sessions, or of course you have to miss the ones that are parallel, won't you? You can get it all recorded. And if those of you in the East decide you have to go to bed before we finish our day here, which is 5 o'clock in British time, you'll be able to catch up with recording of all of it afterwards. So this is an extraordinary time, sad, traumatic for us all, particularly for people who've lost somebody or who've been ill or have worked on the front line, like so many of the people participating today have. And let me just say, on behalf of Nursing Now, thank you for everything you have been doing. So it's a sad and terrible time, but it's also time for us to look ahead. And that's what we're doing today. We want to understand the lessons we've learned from the first year of the Nightingale Challenge and what we need to do for the future. One of the things that's come through so clearly, of course, in recent days is the importance of nursing, the importance of the workforce as a whole, but particularly nurses and how vital they are. And we see the Nursing Now and the Nightingale Challenge in particular as being absolutely vital and essential for the future, for supporting you as young nurses and midwives to develop and to create your own network and to create solutions and to think about the future as the future leaders of nursing and midwifery globally. And let me just say thank you to all the employers who've made this possible, and I know many of whom are on this particular call. We have plans to continue after June next year. We're still working through what that's going to be, and we'll say more about that later on. But first of all, and now it is my great pleasure to introduce Emilia Clarke. She is, of course, an actor, most famous for her role in Game of Thrones. She's also the founder of SameYou, but most importantly for us, she is the ambassador for Nursing Now. And as you will hear in a moment, she is passionate about nursing. So over to you, Emilia, to open the conference.
Welcome, everyone. I am so pleased to be here with you all to mark the first year of the Nightingale Challenge in this, the year of the nurse and the midwife. As we navigate a particularly challenging time for global health, this year of celebrations is providing unprecedented hope that nurses and midwives will at last receive the recognition, support, and development they deserve. I am immensely proud of my work as a Nursing Now ambassador and the opportunity this gives me to support a global initiative that means so very much to me. Nurses have held my hand through my darkest days and led me down the long road to recovery. I am forever grateful for the unconditional kindness, care, and compassion I have been shown in every one of these moments. I believe passionately in the need to raise the profile and status of nursing to give everyone, everywhere, access to quality, people-centered healthcare services. Nursing holds the key to meeting many of the changing health needs of the 21st century. And by investing in the profession, we can not only improve health, but also speed progress towards gender equality and help strengthen local economies. It is an honour to be part of Nursing Now's inspired movement for change and to support nurses to lead, to learn, and to strengthen the profession around the world. With nearly 28 million nurses globally, you truly have the power to drive change. The Nightingale Challenge harnesses this by bringing nurses and midwives together in global citizenship and collaboration. It marks out these professions as the backbone of the world's primary healthcare systems and recognises that the current national problems cannot be tackled in isolation if we are to achieve universal health coverage and meet the Sustainable Development Goals. Earlier this year, the first ever State of the World Nursing Report was launched. This report urges governments and stakeholders to strengthen nurse leadership, both current and future leaders, to ensure that nurses have an influential role in health policy formulation and decision-making, and contribute to the effectiveness of health and social care systems. That's why the Nightingale Challenge has come at such a critical moment. The movement is helping to empower a generation of emerging leaders from the nursing and midwifery professions by creating very real opportunities for them to step up and own their roles as agents of change in their own lives, jobs, communities, and the wider world. It's exciting to know that in this, the Year of the Nurse and the Midwife, more than 740 employers and organisations have accepted the challenge to provide leadership training for early career nurses and midwives. What a sound investment. Nurses and midwives have played a vital role in responding to COVID-19. Now, more than ever, it is essential that governments around the world invest in the nursing and midwifery leaders of tomorrow, and that employers engage and prepare them for the global health challenges that are to come. With nearly 30,000 early career nurses and midwives from over 70 countries around the world enrolled in Nightingale Challenge programs, I think we have every reason to be optimistic. So from the bottom of my heart, I applaud your courage, bravery, compassion, and resolute commitment to transforming how we treat and care for patients the world over. And I ask you to clap yourselves, for in your hands lie solutions to the health challenges we face now and in the future. I wish you all a wonderful conference and every success in your career and journey into leadership. Thank you.
Thank you. Thank you very much, Amelia. And I think let's all give her a virtual hand. We thank her for her role as ambassador of nursing now and all that she has done to shine that light on brain injury through the SameYou Foundation. And she has really recognized the role of nurses in that long process for her. We thank you very much, Amelia. Now, let me also echo the words of my co-chair, Lord Nigel Crisp, when he says that it has been a hard year for us, a terrible year, a year when we have lost some of our relatives, a year when we have lost fellow nurses, fellow health professionals. But it's also been a year when a light was shone on nursing. And we thank you, the very people who have been the frontline healthcare workers, the very people who you are the first, sometimes the patient was the first to see you, but also you are the last person to see the patient, either being discharged or on to a peaceful death. So we are saying hats off to you. For me, this is also a very exciting day, a reflection that since 2018, when we launched Nursing Now in Geneva and in London, all the events that we planned, some of which we undertook, for example, the launch of the Nightingale Challenge, the launch of the State of the World Nursing Report, all the way, we've had some activities that we've had to postpone. But at the same time, we know that, yes, we have been able to extend the celebrations up to next year, July. So we hope that you will be with us. And my hope, of course, is also that this anniversary celebration will actually be also one of those exciting aspects for our employers. and our enrollees, those who are enrolled in the nursing now, in the Nightingale Challenge, to ensure that we go on, we enroll even more people, because in the ultimate, for us, armed with the nursing now, with the State of the World Nursing Report, we should be able to really have that desire to even have even more nurse leaders for universal health coverage. So with that, my hope for the day is simply that we'll have more employers participating, and with that overall ambition to use the Nightingale Challenge. And I'm hoping that we will include more countries, not just more employers from the same countries that we have, but more countries participating. Especially for me, being in Africa, I would like to see more Western and Central Africa countries participating. So I'm hoping that members of the West African College of Nursing, you are there and can be doing that advocacy for that investment in the next generation of nurse and midwifery leaders. So as we say, it's been extended to July 2021, but it is going to go beyond. And we are going to be looking at what else can be done to ensure that the Nightingale Challenge goes beyond. But it should be part and parcel now. It should be in your veins by now that even if nothing is happening, the employers will be able to carry that through, because you will be seeing the fruits and the benefits of having nurses as leaders. So for the young nurses, it's really to encourage you to say you've joined a profession at a very exciting time. Find a mentor, but also be a mentor yourself, because this has to go on. So you have our support, and we are united. We are one. With those remarks, I want to thank everybody, but then introduce a message from our Director General of the World Health Organization, a very sole supporter of nurses, Dr. Tedros Adhanom. Thank you. Is there sound?
Dear Lord Chris, dear friends and colleagues, it's an honor to join you all today to celebrate the first anniversary of the Nightingale Challenge. First, I would like to say a heartfelt thank you to Nursing Now for the dedication they have shown in their mission to amplify the voices of nurses and midwives worldwide, and for establishing the innovative Nightingale Challenge. It's truly groundbreaking initiative, which has empowered a new generation of nurses and midwives to be leaders and advocates. It's incredible that 28,000 nurses and midwives from 730 health providers worldwide have been part of this Nightingale Challenge. I congratulate each of you here today and want you to know that the World Health Organization is your ally. Last year, I was thrilled when the World Health Assembly agreed to make 2020 the International Year of the Nurse and the Midwife. Little did we know that the essential role of nurses and midwives in every community, country, and continent would become more critical than ever in the frontline response to the COVID-19 pandemic. Every day, I'm humbled by stories of nurses fighting for the health of their patients in the toughest of circumstances. My message to all nurses is, whether you're on the front line, maintaining essential services, or involved in vital research, know that the work you're doing is critical to saving lives. You are a credit to your profession and to our global community. In April, WHO joined forces with Nursing Now and the International Council of Nurses to publish the first ever State of the World's Nursing report, which made recommendations about the critical importance of investing in jobs, education, and leadership. The policy options provided in the report are a roadmap for how and where to invest in nursing at national, regional, and global levels. I hope all of you will join WHO in advocating for the implementation of these policies in your country. Next year, we'll see the publication of the third state of the world's midwifery report, which WHO is currently working on with the United Nations Population Fund. The conclusions and recommendations from that report will also be of vital importance for the future of health systems worldwide. I will end by saying that I hope this conference will be inspiring and energizing. This is a chance to learn from each other and share stories with your fellow nurses and midwives across the globe. It's essential that the efforts employers have made in encouraging nurses and midwives to be leaders extends far beyond this first year of the Nightingale Challenge. Sustained investment in leadership within your professions will only strengthen health systems and bring us closer to achieving universal health coverage. I thank you.
Thank you. Thank you, Dr. Tedros, for that.
2020 commencement speaker.
For that wonderful message and the leadership that you have provided for nurses and midwives all over the world. It's my absolute privilege to be the programme lead for the Nightingale Challenge. And I've been on a fantastic journey over the last year in engaging with lots of nurses and midwives from all of the different countries that you have heard have come on board to date. So as we look at the Nightingale Challenge 1 year on, I continue to be inspired almost on a daily basis around the passion and tenacity that young nurses and midwives have to be those fantastic future leaders and advocates for their patients and the profession. And it really goes to the heart of what nursing is about. And I think that the Nightingale Challenge has really encompassed what it is that nurses and midwives are trying to achieve. In looking at the year on, there's so much to celebrate, but as has already been mentioned, we cannot underestimate the impact that COVID has had. And we really recognise that in many countries, such as Latin America and Asia, there are huge challenges going on day in and day out. And whilst some of the Nightingale challenges inevitably had to pause, some have continued, which you'll hear a lot more about today. But actually many are now starting to really become energised again around this agenda. And what we are seeing is that this is a growing social movement working to connect generations and global nursing and midwifery to influence the agenda both locally, nationally, and on a global basis. And crucial to this work is really to empower the next generation of nurses to become those change agents and influences that really do have the passion and desire to improve the care for the people that they look after and innovate around ways that they do this and generate new care pathways and different ways around thinking about how to deliver high quality care for their patients and the local communities that they live and work within. And what's so fantastic about the Nightingale Challenge is that it's a real grassroots movement. We've never said what needs to happen or what people should do. It's a bottom-up approach that really gets the nurses and the employers and the profession in the different countries thinking about how they can really optimise this fantastic workforce that actually has the potential to really change the world. So the challenge was to employers to spot and support early career nurses and midwives that were really up for the challenge, were really up to be put on and in the spotlight to become game changers. And throughout that, we've created this global movement where we've got connections and partnerships and communities of practice and nurses and midwives from all over the world coming together to share the joys of the profession and also some of the key challenges that we face on a daily basis. So when we look at the numbers, and there's been a lot mentioned around these numbers, and it's just unbelievable. Initially, we thought 20,000 would be quite a great achievement to get to, but we've superseded that. We're now nearly 30,000 nurses and midwives from all over the world, as you can see from this graph. But I think as importantly, it's brilliant that the employers are so committed and on board, because it's all about the employers recognising that these people are worthy of investment. They don't have to work for many, many years before they get leadership and development opportunities. And I think what we're finding is before the challenge, there wasn't much there for early career nurses. And now we're finding that there's lots of energy and enthusiasm, and that young and early career nurses and midwives can step up to the plate and be those change agents that they so want to be. And this slide just gives you a further breakdown to show the spread across the world. And as our co-chair, Sheila Clow, was saying, we need to get more in Africa. So really all those folk that are engaged with people across Africa, let's really see if we can get those numbers up. And we're working continually and have some fantastic advocates, again, that you will hear about later in the day from the Nursing Now board, that come from all around these regions, that are really championing this agenda. And they are the ones, in many ways, I think, that have been pivotal in us achieving such brilliant spread across these WHO regions. And again, this slide just really shows you where we're at on that. And the other exciting initiative that we found that's come from early career nurses and midwives is that they want to be global citizens. They don't want to just know what's going on in their own organisation, in their own country, but what's going on elsewhere. And as a result, we started to partner with different employers from different countries. And that's proven to be incredibly fruitful in sharing best practice, creating communities of practice, and also helping to give energy and vibrance around the community so that we keep our nurses, because we all have a challenge, not only in recruiting enough nurses, but also in retaining them. And I think there's some real opportunities here to retain our global nursing and midwifery workforce through these fantastic initiatives that are being led by employers and nurses, mainly supported by us. So if we just look at some of the case studies as an example, so brilliant to see that we've got Guy's and St Thomas's NHS Foundation Trust in London. They're partnering, and the initiatives that they've developed is around crowdsourcing ideas from their staff, developing leadership programs, holding conferences, creating programs for nurse leaders in other countries so that they can share and support countries and hospitals that are perhaps not so well off as themselves financially in terms of their ability to invest in leadership development. They've done all the work, and now it's about sharing that practice and enabling other countries to benefit from it. And then if we look at the specialty hospital in Jordan, again, this was one of our trailblazers that was an early adopter of the Nightingale Challenge. And some of the work that they've been doing is absolutely fantastic. It's really about platforming the early career nurses. It's really about spotting them as the future talent and developing their ability to speak up, to be able to have a place at the table, to have a great mentor that helps to keep them strong and enable them to flourish through their day-to-day work. And then in terms of the wider context of where we're at with the Nightingale Challenge, and we have talked already about COVID and the huge impact that that's had on the programme. But as ever, nurses and midwives are incredibly resilient and have stepped up to this challenge. And as we have already heard, and we know, are doing a great job in tackling COVID-19. but we're also really, really keen to understand the wider context. And through listening and learning from our early career nurses and midwives, they're hungry for other things too. So they want to know about how do we tackle violence against health workers? How do we improve and create the right interventions and support mechanisms so that people have mental fitness, not mental illness? So mental health is really important. We've had the dreadful impact of issues around Black Lives Matter and racism. So how do we understand that that's not acceptable? There's no room for it anyway. And what role do nurses and midwives play as the fantastic diverse communities and population that they are in banishing that unacceptable behaviour? We know about gender inequality. We know that it's a female-dominated profession. So how do we get more men in? What's preventing men from coming into the profession? And how do we rebalance this gender inequality? These are all things that have come from our young nurses and midwives. I think everybody was super delighted about the State of the World nursing recommendations, and it actually speaks perfectly to what the Nightingale Challenge is really all about. So we've got to give high quality education. It's got to be that there's jobs and there's fulfilling jobs at the end when people become registered nurses. And then, of course, they need opportunities to become leaders and change agents. So for us, I think the State of the World's Nursing Report is fantastic in terms of helping to further demonstrate the value of investing in early career nurses and midwives. So some of the support that we've been offering is having conversations, creating webinars around these topics. We've had some focus on compassion and personal well-being because we felt in these times of COVID, it was just nice to think about something different. And how do you build that compassionate workforce? How do you look after yourself as well as each other? We've also been really excited to create more partnerships and share insight. And despite COVID, people are really hungry to continue to learn from each other and with each other. And we're really excited, which we'll talk more about later today, around the next leg of our journey, which is creating global solutions. And this is going to be all about nurses, early career nurses, learning from each other, working with each other to really come up with the solutions that they are, the challenges that they're facing in everyday practice. And the final slide, I think we're nearly there on this now, is around the extension of the Nightingale Challenge, which I was thrilled to find. You know, I think the fact that we've got an extension to June 2021 gives us more time to really learn from our early career nurses and midwives, to really understand why and how all of these employers are investing in their leadership and development, and also to really get more traction across the world. And as Sheila has said earlier, we need more people to sign up. We need more people to engage with this initiative so that it can't go away. We need it to become something that becomes just the right thing to do. So having that extension is fantastic, and we look forward to another year of really pushing this agenda and really platforming the investment in early career nurses and midwives, and why it's so valuable to do so, to raise the profile of nurses and midwives and see their potential. We're looking for evidence bases such as, you know, systemic changes to address issues such as racism, gender and other structural inequalities that young nurses and midwives face every day, but also are hungry to find the ways forward. And as ever, we'll be creating new tools with the community. And that speaks very much to the Nightingale Challenge Global Solutions initiatives that we look forward to launching later this afternoon or this evening or this morning for some of us, depending on where you are. And we really believe that using the partnerships that we've developed as really key to enable further skills in early career nurses and midwives all over the world. So thank you very much for listening, and really looking forward to an exciting day with you all.
So thank you very much indeed, Lisa. I'm just going to make a few concluding remarks for this first session before we go on into our sessions where we look at some of the ideas and some of the issues in much more detail. But what a terrific set of messages people have given us. Right at the top of the list, it seems to me, is that we have, now is the time, really. Now is the time. Now was always going to be the time, but actually the COVID pandemic has really emphasized the role that nurses have globally. The great sadness can be turned, I think, into something that is going to help make real change for the future. There's so much momentum. I mean, wasn't it fantastic to see the Director General of the World Health Organization, Dr. Tedros, taking time to speak to us? He has got probably the hardest job in the world at the moment. And it's been wonderful how over even these months, every month, we have a teleconference with him, myself and my colleague Sheila, and other leading nurses and midwives, the International Council of Nurses and so on. We have a conference with Tedros. He finds the time to talk about nursing and to promote nursing, even during such a terrible time, which is really great for all of us and great for this cause. And as people have said, there is the State of the World's Nursing, which has been so important, and there's the Year of the Nurse and the Midwife. So there's real momentum, real energy, real passion for change. And talking about passion, let me just say thank you so much to Amelia for what she had to say, for her passionate advocacy, for her articulate advocacy. What a great ambassador she is for Nursing Now and for the Nightingale Challenge. And it's with friends like that we will be able to get these messages across. Thank you too to all the employers, and we've heard that mentioned already. Thank you for finding the time and supporting your people, supporting our people, supporting young nurses and midwives for the future. And one of the points that Lisa just talked about in her great contribution, and she's a great leader who's leading this forward for us, is the importance of partnerships. And isn't it great to see that there are partnerships developing between employers and between nurses across the world, because this is a global effort and there's so much we can learn from each other. There's a great saying which I learned from the Institute for Healthcare Improvement in the United States, which is everyone has got something to teach and everyone has got something to learn. And it's so true. And that should be so much part of what we do here in the Nightingale Challenge. And as that partnership develops, what I hope will happen is that we'll see a real network developing between young nurses and midwives around the globe. And what a powerful network that is. As Lisa has just said, we've got more than 28,000 young nurses and midwives participating in this. Now, if even a small percentage of that, let's say, 10% of that, that's 3,000 people, by the way, were to sort of really create a sort of network of learning, of sharing, but also of making sure that the voice of nursing is heard even louder in all the capitals of the world. That will be the most terrific network, the most powerful tool that we can help create. And let me just make just a personal comment. I'm not a nurse. I used to run the National Health Service in the UK or in England, biggest health system in the world with 1.3 million employees. So I've known nursing for a long time. But it's only relatively recently that I've really understood how undervalued nurses can be and how much development, how much opportunity, how much wasted potential there is. Nurses are passionate people. I don't need to say that to this audience. Nurses want to make a difference in the world, and too often they're not able to do so. And that's really why we set up Nursing Now in the first place, was to make sure that nurses were listened to make sure that nurses were at the top table, to make sure that nurses could be all they could be. And our slogan, as you know, our strapline for Nursing Now is improving health globally through raising the profile and status of nursing. And that's the theme, the constant theme of Nursing Now, and indeed the Nightingale Challenge. So we're about to start to look towards the future. We decided that because of the pandemic, we would extend Nursing Now for an extra 6 months. And it will now finish, the campaign will now finish at the end of June next year, so just in a year's time, and that we would extend the Nightingale Challenge till then as well. But we do want to continue it thereafter. We've got such good feedback on the Nightingale Challenge, such good feedback from employers and from nurses and from the various webinars that I know people have been involved in, that we want to continue that. And we will be continuing that, and we'll be talking more about that towards the end of the day. But let me conclude this open session slightly earlier than we planned to do it, by just noting how many people have already joined us. And I hope you're using the chat function and you can see people from all over the world. I mean, I've noticed Nepal and the Philippines, Qatar, Wales, I noticed, Denmark, Spain, Germany, Malaysia, people from all over the world who are joining in this conference, this great teleconference, thinking about what the future holds, thinking about how we develop young nurses and midwives, thinking about how nurses and midwives can play an even bigger role, an even more clearly important role, as they always have done, of course, but an even more higher profile and higher status role in improving health globally. So we're going to finish now, unless my great co-chair Sheila Tlau would like to just make a final word at the end of this session. But we will finish now, and we will go on to go to the global hub, and then come back and get into the sessions for the conference as a whole. I think this has been a wonderful opening. I think there's been a terrific passion and energy from the speakers. So you can see we're all set for a great day, and I hope everyone who's joining the call at some point today will have a wonderful experience. Thank you very much indeed. Thank you, everybody.